Community Solutions is a national nonprofit working in the Northeast neighborhood of Hartford to improve the health and prosperity of the folks who live in this neighborhood. Our areas of focus are threefold. First is physical transformation. We are on a 2.6 acre site that's been abandoned for 10 years, and we're going to transform that into a community hub supporting neighborhood needs. Second is the larger kind of transformation of the neighborhood. And then third, really working with the formal healthcare system in Hartford and in Connecticut to find better ways to deliver quality care to residents. One of the things that we realized when we first got here, that there are a lot of good folks focused on really important objectives, but that they weren't talking to each other. And so really quickly we realized that an important role that Community Solutions could play is really bringing these people together, not only for conversation, but really finding where we can align and really trying to think about who we could put around that table. There are the folks on the ground here with us that are with our neighbors day to day, providing different supports. We take folks from the government sector, state of Connecticut, Medicaid, to folks like Cigna, who have been a supporter not only as benefactors, but also as key content resources in terms of really helping us think about what good healthcare design looks like.
My role personally as the executive director of the Rippel Foundation is to look and scan the environment around the globe for partnerships with not-for-profit organizations that help us to address issues of health equity. And for me, I saw an opportunity for the skills and the tools that we have in corporate America to be used in a neighborhood community health program in a way that they hadn't been used.
It's really proven that once you can build that trust and build those relationships and kind of build that framework, which I actually think is most important because people come and go, but once you build that strong framework and foundation, that it can function as quite a profound engine for the neighborhood.
We're definitely looking at systems end to end here, and Community Solutions calls it process improvement. Taking a look at how all of the systems work together to get help to people more quickly, to those who need it the most. So Cigna, in our role as a convener and a collaborator, is working with Community Solutions to build relationships with local delivery systems, with government entities, and working together, we think that we can build a better process by shining a light in those areas where help is needed most.
What helps create a sense of urgency is not potentially what is the most startling data statistic. I don't think anybody gets up in the morning and thinks, geez, I really think we should decrease diabetes. But when you could say to somebody, what we're trying to do is have the Northeast neighborhood have the same life expectancy of surrounding folks. I think that is something that people can understand, that you can understand that you and your family want to have the same chance. That can build a sense of urgency.
I think what we'll find here is that the number one way to succeed is to collaborate, to bring the stakeholders to the table, to have everyone moving in that same common direction, getting government agencies involved, getting not-for-profits involved, funding sources. If we can all come together and create that vision and all work together, that's the success that we can take to other communities.